Coach Mike in the new and improved AMP Recovery Lab. We're coming at you live on Periscope. There's the whistle. So today we're going to talk about some hip mobility issues that can be causing or contributing to some of your other painful, knee problems or lower back problems. So this is one of our favorite athletes, Dan. Dan, say hi.
Hey guys.
So Dan is a baseball pitcher. He's a right-handed baseball pitcher, and he came to us last year, with a history of, lower back disc herniations, disc problems, and just really having a little bit of a hard time continually training because his low back was bothering him so much. So what we found out through our evaluation process was that really what Dan's kind of crux is that he's got a case of HIRD, which is hip internal rotation deficit. Okay, so when I take Dan's hip and I put him in a flexed position, he really lacks a lot of internal rotation in this hip. Okay, so what we know from the Gray Cook joint by joint approach through the FMS guys is that we need a lot of mobility in this very mobile hip joint, right? And if we don't have that mobility, our body is gonna find it somewhere else. So in Dan's case, because his hips were so strong, he was actually leaching a lot of mobility out of his lower back and creating some instability there. So in order to treat Dan, we had to stabilize and treat, work on strengthening his core, but more importantly, what we're doing in the recovery lab is really trying to open up these hips. So working on his hip mobility is key for him as a pitcher, not only for training, but also for being able to kind of get down the mound and slow his arm down. So without that rotation, without that hip internal rotation, he's going to end up putting more stress on his shoulder, more stress on his throwing elbow, just because that kinetic chain is all connected. So, again, if you guys have any questions out there, we're working on hip mobility today, and this is a really common problem that we see with a lot of our athletes, especially those people who either sit at a desk all day or they sit in school all day. You can really get locked up. So now Dan's been playing baseball all summer. He spent a lot of time on the bus. So, he does his corrective exercise program, but what you can see here still is that he really lacks this mobility. So Dan, if you actually give me this vertical view here, we can show the people at home, exactly what we're talking about, right? So we're talking about his femur's ability to rotate internally, right? So if I try to rotate his hip, he really doesn't have much there. Maybe, we can slap the goniometer on it and show you real quick exactly what we're talking about. We're looking at about maybe 25 degrees of hip internal rotation, and that is not going to cut it. We need at least 45 degrees in order to clear that squat pattern, right? In order to kind of have our hips accommodate that deep hip flexion in a deadlift or a squat, we need that internal rotation. So what we're going to do today is a few soft tissue techniques that I like to use with Dan and a lot of the other athletes that have this problem that really seems to kind of open that hip up, okay? So the first thing we're going to do is we're going to kind of work on his psoas and iliacus, right? So I like to think of the psoas as, the filet mignon, right? That's that deep muscle in your hip, right? It's a hip flexor, but it also kind of helps externally rotate the hip, but it's actually attached to your lumbar spine also. So, if that lumbar spine is the anchor point for that muscle, think about all that stress. If it's too tight, it's going to start to really cause his inability to extend his hip and internally rotate his hip, which is super, super important for a pitcher, but even more so important just to keep your lower back, to keep your knee safe from damage, okay? So what we're gonna do is we're just gonna start to get into the psoas, right? So I like to drape him with a towel. This is really more for just patient comfort, okay? So that psoas, like I said, is a deep muscle in your hip, right? It's, it's attaching to your spine. So we gotta really kind of work deep into his abdomen to kind of access that psoas. And again, guys, this doesn't tickle. This is pretty intense stuff, but if you want results, and we're going to show you just how much rotation that we can get after the fact once we work on this hip, right? So first thing I'm going to do is just drape this towel, like I said, and I'm going to start to just kind of access some of this tissue deep in his hip, right? So right now what I'm working on is right above his hip bone, okay? I'm just going to kind of tack my fingers down in there and rotate his hip in and out, right? So again, tacking my fingers like deep in his hip right here. If I take the towel away, you can kind of see, get my fingers right inside that hip bone, and we're just gonna kind of start to mobilize some of this tissue. So really what I'm doing is I'm just tacking that muscle down. Right now I'm really working on his iliacus more so than his psoas, but we'll get to that. This is another deep hip flexor. So we're just gonna work on this hip flexor and just range that hip through that external rotation, okay? So we're just gonna tack that down, pin and stretch. Basically what we're doing is a pin and stretch technique. okay? You know, Dan is very used to this, so he's going to be pretty stoic when it comes to, you know, the depth that I can kind of work with him. But again, you know, for you athletic trainers out there, for your PTs, your, you know, massage therapists, you know, this is going to be something that you have to work with your clients a little bit at a time. Again, Dan is kind of conditioned to doing this, so he's, you know, really able to relax and let me get down in there. But, you know, you want to do, you know, start with very, very light pressure and just, you know, start to build that trust with your client so that they'll let you access some of these deeper muscle layers. Okay, you know, I'm knuckles deep, you know, in his belly right now, so that's, you know, definitely not going to tickle. But again, just because he's able to relax, it allows me as a clinician to get the penetration, the depth that I need, and also not to crush my own hands when I'm working on this. So I just did about 8 to 10 strokes of pinning down that iliacus and mobilizing him in external rotation. So now what I'm going to do is kind of work up into that psoas, okay? So again, guys, you got a lot of stuff in your abdomen here, right? You got your stomach, you got, you know, miles of intestines in here, but all of that gut is kind of contained in a sac, right? So if I take my hand and I can just gently push straight down, that gut sac will move out of the way. Right, so now I'm really able to access the under part, or really, you know, the part of his core. Remember, we used the analogy, you know, a few videos ago of a barrel, right? He's got a bottom of the barrel, the top of the barrel is your diaphragm, and that core is really the outsides of that barrel. So what we're talking about is the muscle tissue on the back side of that barrel, really that psoas, that iliacus, you know, your paraspinals all make up that, and actually your vertebrae too in your lower back. So I'm just going to push straight down. Okay, move that gut sac out of the way, and then I'm going to work my fingers up and in towards his sternum, okay? So again, that's the orientation that psoas lies. So if you're one of those people who sits all the time, this is going to be that muscle that's locked up on you, that's cranking on your lower back, right? So what I'm doing is just the first few strokes, I'm just kind of feeling around, and I'm going to find that filet mignon and just kind of like, you know, kind of tack it down, okay? So I know I got the spot because Dan winced a little bit, so I know I'm on it. So now what I'm going to do is just lock that muscle down, okay, in that hip flex position. Now I'm going to start to just extend that hip a little bit at a time, right? So when I get to this point, I can feel a ton of resistance. I'm just going to bring him through that hip extension and then back up, okay? So there's a couple of tactics, right? This is really tough on my hands and my body. So, you know, you want to make sure that you're using a lumbrical grip if you can, meaning that I'm using the muscles deep in my hand, not my fingers, you know, to hold that contraction, right? So I either like to use the pincer grip, where I lock my thumb on the outside of his hip bone and I can get my fingers deep in there, or I'll switch that on the opposite. But just keep that in mind. If I'm using my thumb in here, that is a lot less surface area, which means two things. One, I'm going to get deeper. Two, it's going to be more painful. Okay, so I've done this with Dan many, many times. So I'm comfortable and he's comfortable with me going to that thumb position, right? So I'm actually going to guide my thumb down into that psoas. I just found it. I locked onto it using my other hand. Now I'm going to lock on there. I'm going to flex that hip up again, and I'm just going to kind of take that hip through extension. Maybe, you know, again, 5 to 8 times seems to be the sweet spot for a good release. Again, I'm just tacking that muscle down, pinning it, and then I'm just allowing it to glide under my muscle, okay? So what we're doing is psoas release, okay? This is going to be very key for you if you're locked up in hip internal rotation, but even more if you're locked up with hip extension. If you can't extend your hips, this is a reason why you can't. If you sit all day and you have low back pain, this is the soft tissue reason for why that low back pain is happening, okay? So you can do, you know, again, if you're at home, you can actually get a lacrosse ball or something like that and just kind of work it deep into this psoas, right? And just start to mobilize some of that connective tissue, some of that soft tissue, and that will, you know, decompress those lumbar vertebrae for you a little bit and hopefully give you some relief, okay? Now, for a few athletes out there, if you find that soft tissue guru in your area, you can definitely, you know, get somebody to help you kind of release some of this tension, okay? And for Dan, it's just super important because he needs this hip mobility to pitch. Again, if you guys have any questions about what I'm doing, why I'm doing it, please shoot us a message, leave us a comment on our YouTube channel. We'd be happy to answer it for you. Again, we're working on hip mobility problems. So, you know, I just worked on his iliacus into external rotation. I worked on his psoas into hip extension, right? So I haven't even touched his internal rotation yet, and I'm going to show you guys the difference. So we did a 25 degrees of hip flexion and internal rotation. Look how much I've already freed up just by doing a little bit of soft tissue work. Again, Dan is used to this kind of work, so he is super adaptable when it comes to this, but I'm gonna just slap the goniometer on there again. And now we're at 45 degrees, okay? So that's an instant result of about 20 degrees of internal rotation. That's pretty atypical. You're not gonna put a lacrosse ball in there and gain 20 degrees of internal rotation, but this is something that we can do in the AMP Recovery Lab in real time right away. Again, this is more what he needs to accommodate that deep squat position, okay? Or that hip hinging position where he is throwing that baseball and he's gotta rotate into that front hip, okay? So this would go for golf, this would go for tennis serve, this would go for a volleyball serve, or even just hitting a volleyball, throwing a ball, baseball. This is something that you want to check. If you've got elbow, shoulder pain, check your hip internal rotation. If this is lacking, this is probably the kink in the system that's allowing extra stress to go to that throwing arm, go to that serving arm, go to that swinging arm, okay? If you're having low back pain, this is definitely one of those areas that can kind of seize up on you and start to create a lot of tension and torque on those lower back vertebrae. So we're looking at hip internal rotation. Okay, so there's one more technique that I really like to do, okay, with these guys that have, a lot of pain and tenderness in this area. So I did some soft tissue work. If I didn't get the result that I just got, one of my go-tos is actually to do some mobilizations with a strap. And we're gonna do some contract, relax, PNF stretching, okay? So again, I just wanna go over like the 3 types of tissue in our body, right? Bone, which we can't change, muscle, which is adaptable and changeable, and the connective tissues, right? Tendons, ligaments, that kind of thing. So what I just worked on was the muscle, okay? So we did some muscle release, we did some ART techniques. If that's not giving you the result that you need in terms of mobility, your problem is probably connective tissue-wise or capsular. And that, for Dan, used to be a huge problem for him, where we had to do a lot of these mobilizations to open up that hip capsule and then loosen up his muscles. So I'm not gonna do this full on with him because he doesn't really need it right now. I just wanna show you guys the technique and the setup, right? So I've got this mobilization band, right? I'm gonna anchor this around my body. Okay, and I'm gonna bring him up into hip flexion. So what I wanna do is kind of create the same kind of stress that I would need to mobilize that capsule, right? So if he's lacking hip flexion and internal rotation, that means it's his posterior inferior capsule that's a little bit too tight, okay? So the setup for this, right? The first thing I wanna do is just apply a little bit of lateral traction. And really for me, what I'm just doing is kind of hinging into my own hips to pull a little bit of traction. This is just distracting the ball from the socket enough so that I can kind of manipulate and put a little bit of this capsule on tension, okay? So I'm just gonna hook my arm around his leg. So the first thing I wanna do is give a little bit of lateral traction and a little bit of posterior pressure, right? So I'm actually pushing down onto his hip, so I'm mobilizing that inferior capsule, and I'm gonna rotate his hip as far as I can into internal rotation. Okay, again, so I'm not gonna go full out on him because he really doesn't need this right now, but what I'm gonna ask him to do now is actually flex his leg, right? So you're gonna flex, isometrically contract those muscles, and then relax, okay? Again, flex and relax, and each time I'm gonna just take a little bit more, okay? Again, flex and relax, okay? And I'm taking a little bit more, one more time, flex and relax. Good, so if, 3 to 5 times, and what you'll notice is you're gonna gain a lot of range right away, okay? And that's really powerful stuff, but, it's only part of the equation. Again, Dan used to have this capsule problem. He doesn't so much anymore, so I'm not gonna really concern myself with mobilizing it too much. But again, what we just did, 2 to 3 reps of that, we've even gained even more internal rotation there in his hip. So now he can really get deep into this hip when he's pitching, and all of that stress will be dissipated by this hip socket, right? So that's what our joint spaces are meant to do, dissipate that force so that you can accommodate more stress in the system, okay? So again, his hip mobility now is well within normal limits. You're looking for 45 degrees of external rotation and 45 degrees of internal rotation, okay? All right, so that's a pretty good start. Again, if you're having some of those low back issues, this is definitely where you want to work on. Do I have that ball laying around here? I can show that self technique. No ball. Okay, again, so if you're at home, that's where this lacrosse ball can come in very, very handy, right? So you take that ball, you stick it right where I stuck my hand, flex this knee up. That ball's gonna go right, maybe an inch or two west or east of your belly button, And then you can put like a dumbbell or a kettlebell, or even just use your hands. Press down right on top. And then, like I said, just kind of mobilize that hip in and out. You know, maybe 5 to 8 reps going in and out, and then flexion extension, 5 to 8 reps. And that'll really help kind of open up that hip. Okay, obviously do that on both sides. You know, I just worked on Dan's hip before we came live on Periscope with you on the right side. So, you know, I really just wanted to show you guys the left side today and how this can kind of really influence, you know, that deep squat position or that deep hip flexion when he's throwing, right? So, Dan, why don't you pop up for us? Let's get a few squats in. Let's see how you're feeling with that. Right, so he's able to get a lot deeper into that hip. And Dan, if you can come on this side, we can show you just, you know, this, Dan, you face straight ahead. Okay, so when he's squatting, if he lacks that mobility in his hip, one of two things is going to happen. Okay, so go ahead and deep squat. If he lacks that mobility, either this knee is going to drop in because he just doesn't have the mobility to get there, or he's going to dump his lower back off. Okay, right? That's that butt wink that we don't want to see in a deep squat. Right, come back up. Okay, so, you know, now I'm having him squat because I just created a new range of motion. You got to use it right away. Okay, so if you create that mobility, that's great. But if he just walks out the door now, that mobility in about 20, 30 minutes is going to go right back to where it was. Okay, this is where I like to do some like maybe wall sits, or even just some of these, you know, body squats are great. Just get down deep into that hip. Maybe let's go like 8 to 10 of these. Hold at the bottom, 3 to 5 seconds, and then straight back up, drive to the heels, hips all the way through. Okay, so this is a really great way to then teach his nervous system how to stabilize that new range of motion, and that is the key. If you want this range to stick, you got to use it right away. So in that 20 to 30 minute window after you've established new range, right? So that's why at the AMP Recovery Lab, I like to work on my athletes before they train, right? So if Dan is coming in for a training session, I can mobilize that hip for him, and then he can go use that new range right away in his squat day. And that's what's going to give you that lasting change that's going to stick with you a little bit longer, right? So again, you know, Dan's been working on this for a long time. You can see how quickly his comes back. That's because he's constantly working on it. You just need a little tune-up here and there to continue to help him make those gains in training, okay? So a couple more, and then we're going to wrap it up today, Dan, okay? Sound good? Right? Again, so you can see how he's able to keep that low back a little bit flat. You know, beforehand when we checked this, he was really dumping his lower back. Okay, back up. Maybe one more time. And back up. All right, guys, I hope you enjoyed the video today. You know, again, if you're not following us on our Twitter or Instagram, it's @amp_athlete. On Facebook at Athletic Movement Protocol. Please sign up for our newsletter on our website at athleticmovementprotocol.com. We'd be happy to send you the notes and just more stuff coming down the pipeline here from AMP. Just want to thank you guys for watching, and please check us out on YouTube. Leave us some comments, leave us some questions. Let us know what you guys want to see, you know, for our next Recovery Lab video. This is Coach Mike signing off.